This is the Neuro Way to Practice podcast with Dr. Ted Arkfeld. In each episode, he shines the spotlight on patients who have achieved amazing results the Neuro way. Now, here's your host, Dr. Ted Arkfeld.
Hello. I want to start off by telling you a true story. John's waiting in the Social Security Disability Evaluator's exam room, waiting for the doctor to come back in and tell him if he is going to be on permanent total disability. He kind of already knows the answer to this because he has not been able to do his normal activities, do his normal job as a framing carpenter for the past 4 years. Ever since that fateful day when he was driving to work and a car ran a red light, struck him on the driver's side, and he began having low back pain. He woke up the next day and the pain was pretty significant and he wasn't able to go to work, and the pain kept getting worse and worse every day. Went to see his primary care physician, and he was referred on to an orthopedic surgeon who gave the recommendation he needed a spinal fusion. L4 and L5 were a little too sloppy, and they needed to take a bone out of his hip and basically weld it so those two would stabilize. So he had that done. He spent about 2 weeks in the hospital, and he was in a full body cast for about 6 to 8 weeks. He's in a full body cast for about 6 to 8 weeks, and comes home, gets the cast off eventually, still having pain. Can't do his normal activities, can't do anything without pain. So roughly about 9 to 10 months later, he has a second spinal fusion, and pretty much the same outcome, still in pain. And roughly about 2 years go by, and then he is seen at what was the elite of the elite, the Mayo Clinic in Rochester, Minnesota, and he has a third spinal fusion. Now, during this time, he develops a staph infection. He wakes up a few days after his surgery, and he's in excruciating pain, and they find that he has a staph infection. So he goes in for another surgery because they got to clean the infection out. And during that time, something goes very wrong, and he is clinically dead for about 45 seconds to a minute. And during that time, John relayed the story that he's walking through a tunnel, and on the left side, it's calm, it's serene, it's beautiful, and he so much wants to go to that side. He looks to the right, and he sees his wife, and he sees his 6 kids, and they're crying. And he knows right then he's got to fight. He's got to fight, as he put it. He had to fight like hell to get back over to that right side. He's drawn to the real calm and serene, but he knows he can't. It's not his time yet. Fights his way back, wakes up, and a year after this surgery, finds himself in this doctor's office. He already has made that transition from chronic pain into it becoming a behavior. Because after 3 spinal fusions, being put in these body casts, the muscles in his low back have atrophied so bad. The joints are not moving like they should. And quite honestly, what John is suffering is neurological malnutrition, neurological starvation. So he has already started this behavior that if he does too much, if he doesn't hardly walk, he'll go out to the mailbox, he'll walk around a little bit, but once he starts to do any activity, it hurts. So it leads to a very sedentary lifestyle, a lifestyle that if there is activity, he's going to have pain and he will pay the price. He also at this time is not real nice to be around when the back is hurting. and he becomes angry. I don't know if there was anxiety or depression because that generation of men didn't talk about that. Hi, I'm Dr. Ted Arkfeld, and I am the founder of the Neuro Way to Practice podcast. I start off with this story because John was my father. I grew up in a chronic pain family. And so when I say chronic pain family, the person that is in the pain, it affects everybody. I specifically remember I was in kindergarten when I first saw my dad standing at the rail of the hospital 2 floors up, because back then we couldn't go in and see him. Kids were not allowed. I remember him coming home, and I wanted to be able to play with my dad because he had been gone. He had been gone for 2 weeks in the hospital, and he has this big old body cast on. And I was always told, no, you can't jump up on dad. You can't do any of that. My earliest recollection of my nighttime routine was to get down on my knees and say a prayer every night. I hope my dad's back feels better. I tell you this story because looking back on it, this is the why I became a chiropractor. I I really believe that I became a chiropractor because, well, first of all, dad did go to a chiropractor. We all started going to chiropractors, and he had some relief, but he was looking for a cure. And by that time, there was no relief. So about 4 years ago, I brought in this amazing technology into our office. It's called ARP Neurotherapy. Stands for Accelerated Recovery Performance. It's a neurological stimulation. And see, our body is made up of receptors. So do you ever wonder why a normal healing time has come and gone, and yet patients are still in pain? They're in chronic pain. Have you wondered why patients that have had supposedly a successful surgery, because they've gone back to the orthopedic doctors and the doctor said, that was a success. We got the bad anatomy cut out of there. When dad went to his orthopedic surgeon, they thought it was a success also. Yet there he was still in pain. Every time he did something, he had pain. So the new and the latest neuroscience research now tells us that there's got to be a different explanation besides a structural problem. So in dad's case, it wasn't a structural problem. For you out there right now that are listening to this and may be suffering, it may not be a structural problem for you. For you doctors at chiropractic that are on this live broadcast and you're interested in what I have to say, I can tell you that I've been in practice for 36 years, and this is the most amazing thing I've ever seen. It beats laser therapy, it beats spinal decompression, it beats everything. It's why I am so fired up and I get excited every morning to get back into the office, because I'm making an amazing difference in patients' lives. What I really am doing is I'm providing hope. And so if you're hurting out there and have given up and you think, oh, I can't afford, not financially, I'm talking about emotionally. I can't emotionally afford to get excited about anything because I've been let down way too many times. I'm here to tell you, get excited, because I've seen it happen over and over again. Once I brought ARP therapy into the clinic, I started wondering what would have happened if dad would have had this therapy. What would have happened if we could have got this type of advanced technology doing exercises with him? How would his life have changed? How would the whole life of my brothers and sisters and my mom, how would it have been different? How would the trajectory been different? One of the things is that when I developed the Neuro Way to Practice program, it was after it was after 32 years in clinical practice. It was after I brought the ARP therapy into the clinic, and then I began to do more neurological training. So our bodies are made up of receptors. It's really very, very simple. And this is why we get results when others have failed. Our bodies are made up of receptors. So there's receptors in our joints. They're called joint receptors. There's receptors in our muscles. They're called muscle spindles. There's receptors in our tendon. They're called Golgi tendon organs. There's receptors in our skin. They're called mechanoreceptors. The sole purpose of these receptors, when stimulated, is to fire that information up to parts of our brain. The brain then knows what's going on down here. So when the receptors aren't firing, the brain doesn't get a true representation of what's happening. And that part of the brain becomes very blurry. And when you get blurry brain maps, it lowers the threshold for pain. So you see, it's not really a structural problem anymore. It definitely is not a bone out of place pinching a nerve like a lot of chiropractors will tell you. It is not a disc that is bad because everything's healed up already. Where we get results where others have failed is because we look at it differently. We look at it from a neurological standpoint. Where others have failed is because they're continuing to look at it from an orthopedic standpoint. So I wonder, with Dad's muscles atrophying and those joints not moving and him being very sedentary, I wonder what would have happened if we would have been able to do ARP neurotherapy on him. I think the results would have been totally different. And the reason I say that is because I see it every day in practice. I want to share another story with you that really reflects the amazing outcomes and how we made a difference in patients' lives. And quite honestly, I could tell story after story after story. But I want to start with this one. Melissa came in to see me, and I'll never forget the first time I saw her. She sat across and she was upset. I could actually say she was pissed off. And I said, Melissa, what brings you in today? I don't know. I don't know why I'm here. A chiropractor did this to me. I have no idea why I'm here. I said, well, why are you here? Well, my sister told me that if you couldn't help me, nobody else could. And I said, so really, I'm kind of your last hope, right? And she goes, well, yes. So I said, tell me your story. And she did. She had had 2 surgeries. Once again, there was a staph infection that occurred after her lumbar spine surgery as well. I shared the story of my dad. And what's really interesting is that we were told for a long time in the family not to tell the story about the near death experience, because back in the 70s they thought you were woohoo if you did that. So we never told the story. And actually, I think this is probably one of the first times I ever told the story in public. In all the years I've done seminars, I don't think I've ever told the story. Anyway, Melissa's there, and I said, okay, Melissa, we are going to do a real good examination on you. I'm going to examine you totally different than you've ever been examined. And then I'm going to let you know what I think's going on, and I'm going to give you what I believe will be an appropriate therapeutic intervention. See the words that I use, therapeutic intervention, sounds better than treatment program, right? So I did the exam. We had the RX machined from ARP Neuro, and there's a scanning feature on there that will identify areas where the muscles have broken down and can't absorb the forces. We did that. We found the hot spots. So I told her, we need to see you in order to create a neurological input. You're neurologically starved right now. Your brain is not getting the information from these receptors. You have a blurry brain map. I said, I don't believe there's a lot going on in the area where you had the surgery. You may have some scar tissue down there, and it could be affecting some of the nerves down there, but I don't think that's the main thing. I think the main thing is that your brain is in a bad cell coverage area. You got one bar going on because you're not getting the information up, and when you do things, it increases the pain. See, she was becoming very, very frustrated because she was an active exercise enthusiast. She is a teacher and she's a mother too. And she was sinking deep into a depression because of the pain that she was living with every day. She told me, I cannot live this way. I cannot get up every morning and hope that something miraculous happened and that I'll be out of pain today. I can't continue to go down this path. So I told her at the first day, I said, I believe we can fix that pain for you. I didn't say we could fix the structural issues because, quite honestly, at that time we couldn't. But I said, we can help you. And I said that with the utmost certainty because I'd seen it numerous times before. So we began the treatment program and we used a very gentle chiropractic adjustment because one of the things that she was adamant about, I can't handle, laying on the side and cracking my eye. I can't do that. I said, we're not going to. We're going to do what we call Cox flexion distraction technique. And we're going to have the RX machine on you. And we're going to be getting 500 impulses per second hitting your muscle spindles down in your lumbar spine. See, here's the thing. The reason laser therapy and spinal decompression doesn't really give long lasting relief is because it's not getting to the cause of the problems. The reason Melissa had gone through physical therapy, 2 rounds, she had had epidurals, 2 rounds, and it had not done anything. It's because they, again, were looking at it from an orthopedic standpoint, and they didn't get to the true cause. See, these muscle spindles in her low back, the ones that weren't firing, that was creating a bad cell coverage area, they were located in muscles that are the spine stabilizers. And so the spine stabilizers, those fire up to a part of our brain called the cerebellum. Cerebellum is our posture, our balance and coordination. And that was one of the things that she said, I feel uncoordinated. I feel sometimes when I'm walking, I just don't feel my feet. I said, well, I think we can help with that. And so all we did with the adjustments and with the ARP neurotherapy is we bombarded her with neurological input. We got her into a good cell coverage. We turned on the juice, basically. We lit her up. That's called afferentation. We provided a lot of stimulation. She came in about 18 visits later, came in and broke down, started crying. And she said, I went to the gym today for the first time. I was able to teach standing for the first time without any major pain. I slept through the night, the last night, without getting up because I was in pain. I woke up hopeful. You have given me my life back. And this is something that if you decide to go down this stream, you're going to hear this over and over again. I never imagined doing anything with post-surgical rehab. Never imagined doing that. I didn't feel like I had the tools to do it, but I do now. We have taken so many patients that have had post-surgical issues, not just the ones that have gone through PT to begin with and now are coming in because they're still in pain. We are getting patients bypassing physical therapy coming into our office right away, 3 days later after surgery to begin their post-surgical rehab. And I love it. And we're making a difference. And I will tell you that we are getting a lot better outcomes. We are shaving off weeks, if not months, off their rehab. And it's done within a 30-minute time period. And they're just so happy. And we're getting people back to work. We're getting kids back to participation. We're making a difference in their lives. I do wonder what it would have been like if I would have had that therapy for Dad. I always will wonder that. I think that I migrated a lot subconsciously in different areas, especially, for example, this all happened because of a car accident with Dad. And when I practiced in Phoenix, I basically focused on motor vehicle accidents. I found them very challenging, very rewarding. And, I look back now and I think subconsciously I was really trying to save every patient that came in from a car accident. I was trying to save them from becoming a chronic pain patient and have the families become a chronic pain family. I brought that same, I think, subconscious mentality when we relocated back up here to Michigan, and I began working in a pain clinic. I was trying to help all these chronic pain patients. And then when I opened up my own clinic, and 4 years ago, when we brought in the ARP Neuro, it's been amazing. It's been absolutely amazing. So, what I want you to do, if you are somebody that is suffering, if you know somebody that's suffering, I want you to email me. Email me at the address below. I want to hear your story. Okay, I'll probably even set up a phone conference with you or a video conference, because you may not be in Michigan, you may not, but we can still. This is the thing that COVID taught me: home-based therapy, and we're developing home-based programs. If you're a doctor of chiropractic and you want to take your practice and really make a difference in patients' lives, if you want to explode in areas that nobody's ever thought of, post-surgical rehab, one of them, patients are looking for answers, and the answers are not being given. The solutions are not being given. I want you to send me an email as well, and we'll get on the phone and we'll have a discussion. So I want to thank you. I want to thank you for being here today, and I want to go ahead, and if you have any questions, I want you to go ahead and type into the chat if you have any questions. So go ahead. Give it a few more minutes. And that's okay. If you're a little shy, you can't think of anything, that's the reason I want you to email me. So the question is, how does this help with post-surgery? When somebody has undergone surgical repair, the brain has to recalibrate to make up for like a part of anatomy that's been taken out or the changes that's been made. And what ARP neurotherapy does, because it's a neurological stimulation, it fires up basically the muscle spindles, which is huge for us. We have got to get the muscle spindles turned on, activated, so that they support whatever area. What we also have found is that when we start to stimulate certain parts of the brain through the spinal cord, through our efforts at rehab, that we are turning the brain back on so that it has a clearer vision of what's going on down where the surgery may have occurred. So it will actually raise the threshold now for any kind of discomfort. It's about movement. We've got to get the patients up and we've got to get them moving. And that's what ARP neurotherapy is all about. It's about movement. And so we are able to get them in a very safe and effective manner moving, and we're firing up areas of their brain. In other words, we're lighting the furnace again and putting the lights back on. Any other questions? All right. Hey, thanks for attending. I really appreciate it. And please do send me an email. I want to hear from you. Have a great day.